Good morning, friends. Welcome to our next teaching session. The subject for today is hypertension. You are all aware of the medical term for high blood pressure. It is called hypertension. Do not confuse hypertension with the usual layman mental tension and more of mental tension as hypertension. No, this is increased blood pressure which is called hypertension. When heart contracts, it generates pressure to push the blood in the arterial bed to supply nutrition to the entire body, including heart. This force generated is called blood pressure, and when the heart relaxes, this force decreases, and this is called diastolic blood pressure or lower blood pressure. This is during the phase when the heart is not contracting. The lower blood pressure, so-called diastolic blood pressure, is due to the constant state of arterial constriction, and therefore figure is less because heart is not pushing in this stage. Now we must know when we should go to the doctor. Should we treat the hypertension? Should we take the drug therapy? Or can other measures also help? But we should not neglect it. What harm will occur if we do not take the treatment? Or we do not keep our blood pressure controlled? All these things we are considering, I will consider here. And which blood pressure is more important? This also is very important. Let us start with one thing at a time. Let us see, why should we treat blood pressure? Friends, it has been seen over time by the scientists and experts on hypertension that the higher the blood pressure, the lesser the life expectancy, the more are different type of complications. For example, in uncontrolled hypertension, the stroke is 7 times more common. The heart attack, that is myocardial infarction, is 3 times more common. And heart failure is 4 times more common. Peripheral arterial diseases like involvement of foot due to lack of blood supply is 2 times more common in uncontrolled hypertensives. Therefore, when we treat the hypertensive patients and bring the blood pressure down within a reasonable range, we prevent these complications and we prolong the life expectancy of the patient. That is the reason why we should treat hypertension. And why should we go to the doctor? The doctor is the right person to detect whether we have hypertension and whether we need drug therapy or lifestyle modifications or both combined together. Which type of medicine is required? That also the doctor will decide. Which time of the day medicine should be taken? The doctor will explain you that also. Now, of the 2 blood pressures, we said the upper one and lower one. The upper one, we named it as systolic blood pressure. Systolic because when heart contracts, it is called systole. Contraction of heart is called systole. That is why we say the blood pressure generated during the contraction of the heart is systolic blood pressure. And blood pressure when the heart is relaxing is diastolic blood pressure because the relaxation period of the heart is called diastole. So having known that what is the blood pressure and why should we treat it, then we come to the high blood pressure or what is the level of normal level and ideal level. First I tell you what is the ideal blood pressure. Any blood pressure 115/75 or below is ideal blood pressure. But if you do not have ideal blood pressure, still you can have normal blood pressure. Any blood pressure which is less than 85 diastolic is a normal blood pressure. I show you certain levels of blood pressure. See, if the blood pressure is is below 130/85, it is normal blood pressure. If it is 140/59, 140 to 159 by 85 to 89, then it is high normal blood pressure. If the level is 140 to 59 by 100 to by 90 to 99, then it is the mild hypertension. If the pressure is 160 to 179 by 100 to 109, it is moderate hypertension. And any blood pressure above 180, equal to or above 180 by equal to or more than 110 is severe hypertension. Two more terms you should know along with this thing. That is accelerated hypertension. What is accelerated? When the blood pressure goes on rising, it is called, it has entered accelerated phase. And the malignant hypertension, when the levels of blood pressure are 240 by 140 millimeter of mercury or above, it is called malignant hypertension when combined with the papillary edema. Now I show you certain diagrams of the retina, that is your eye curtain, your film where the picture is formed, how you see the things. You see this whitish, pale whitish area where I have written OD, just on the side of OD, from where vessels are, blood vessels are going, red lines are going. The white area from where red lines are going, that is the optic disc. Optic disc means the place where the optic nerve enters the eye, enters the retina. Now, what is optic nerve? Optic nerve is the nerve of vision by which we see. It takes impulses from here and gives to the brain, where image is formed, and we know that we are seeing something. Now, see, this is optic disc, and let us see another diagram. See, let us see this diagram. Now, see, I have marked it as PE means pulmonary papillary edema, H I have marked as hemorrhages, and E I have marked as exudates. Whitish fluffy areas in this diagram. I am keeping the diagram here so that you can make notes of it. Fluffy area, whitish pale fluffy area is the exudates, and reddish area is the hemorrhages. Hemorrhages means bleeding. Bleeding is occurring from the blood vessels into the retinal wall. And see another diagram. You have also seen the swelling in the area of the optic disc. Then see another diagram to understand it more clearly. See this diagram. I will keep it here for you so that you can make a note of it. Later on study it also. And E means exudates, and H means hemorrhages, and OD means optic disc, and it is all swollen optic disc along with exudates and hemorrhages. Well, friends, this is also a very serious condition. Malignant hypertension requires immediate treatment. You should also know that which blood pressure is more important or causes more damage to the body. It is the upper blood pressure, systolic blood pressure, which is more troublesome or more damaging. So, if somebody has a blood pressure of 140/82 millimeter of mercury, and another person with similar characteristics has a blood pressure of 160/82 millimeter of mercury, the person with 160/82 is more at risk of diseases, suffering, as well as death, as compared to the 130 by 82, because it is a systolic blood pressure which is more important. Here we have found that diastolic blood pressure is common, is same in both these people. So after having known all these things, we must consider that what treatment we should get. Friends, I will be dealing with these different subjects of hypertension at a later stage, but it is very important to understand what we are summarizing at in the today's talk. For example, I said what is the ideal blood pressure for a person? It is 115 by 75 millimeter of mercury or below. And what is the normal blood pressure? Normal blood pressure is below 130 systolic and below 85 diastolic. And any blood pressure which is above equal to or 180, it is severe hypertension, and if diastolic blood pressure is equal to or more than 110, it is severe hypertension. So it can be a mixture of all these things. Some people can have only systolic hypertension, the others can have only diastolic hypertension. Usually most common is the systolic as well as diastolic hypertension, what is called mixed hypertension. So if you have hypertension, go to the doctor, have treatment. Do not be under the wrong impression that hypertension is cured. Hypertension is not cured, it can be controlled, and controlled hypertension can prolong your life expectancy. So friends, like, comment and subscribe if you have already not done it, the video, and please do not give your comments and thumbs up and other emojis on the messenger. Messenger I use only just to send you the link. I in fact do not like to converse on messenger also. I like either to be talked on Facebook or on the other media like mail or other thing, because the time doesn't permit me to talk to people, and some people get annoyed. Please do not mind, because my time is for the patients, my time is for making vlogs, my time is for making videos and making you understand the things. I hardly have any time for gossiping. I have to give some time to my family also and look after my affairs. So please do not mind if I do not pick up your calls, and I prefer that you write if there is really something important, then only. And I also make it clear. Certain people have asked me and I have refused it. I make it clear here once again that I do not treat people on the WhatsApp or on the messenger or this thing, because this is unethical. This is not a proper way to treat. I have seen many people writing on the various groups, asking medical groups, asking treatment for certain diseases, or asking which antibiotic they should take, or which. These are all unethical things and also illegal also. So please do not ask me such things, and I will not be able to contribute towards that. I think the right way to help the patient is to listen to complete history carefully, ask certain questions from the patient, and look at the patient himself or herself, and to understand what disease likely she is suffering from. But you can sometimes diagnose by seeing the patient, you cannot do it from the history, and what history can tell you may not be clear from the seeing the patient. So it is very important to examine the patient as well as listen to the history, corroborate the history with the examination to make a proper diagnosis and treat the disease. For example, you know it that if somebody is having shaking of hands, these are called tremors, and these tremors can be due to a number of reasons. It can be because of thyroid disease also, or it can be because of anxiety neurosis also. It can be because of hepatic failure also. So what treatment I tell people who ask me on the Facebook or Messenger or WhatsApp that what is the treatment of tremors, how can I tell them or which drug they should take? So please do not put me in difficult situations by asking such questions. Thank you very much, and see you next time with another topic.